Going to the dentist is a relatively new phenomenon. But did you know that people used to use a toothpaste even as at 500 BC? Luckily, these days there are new phenomenon and tools to help you have a better dental health. There are so many things that you can do to have better oral health. But you should know that you use your teeth and your mouth to eat every single day. It's just fair enough that you know a lot more about your oral health or your dental health. That is why I'm here today at All Smile Dental Clinic to talk with a dentist and get to know about oral health in Africa, stained teeth, and a whole lot more. Join me, Bridget Amadente, as I interact with a dentist at All Smile Dentist Clinic here in Osu. You're welcome. We are here at All Smile Dental Clinic and it's a very beautiful place, as you can see. So welcoming and so beautiful. I'm here with Dr. Emma Oliveira. She's a specialist dental surgeon and she's going to help us delve more into dental cavities and decay. Later into the conversation, you will know that cavities is a layman term. It's supposed to be caries. Doc, you're welcome.
Thank you very much.
It's a pleasure to have you here.
Likewise.
Yeah. Please tell us a bit about yourself.
Okay. All right then. So I'm Dr. Emma Oliveira, as you already know. I'm a specialist dental surgeon with great passion for cosmetic and aesthetic dentistry.
Okay. So when we say cavities, when we say dental cavities and tooth decay, what exactly are we looking at?
Okay. So tooth decay or cavities, they are when decay-causing bacteria forms acids that affect the tooth surface or the enamel, creating tiny holes in the tooth.
Okay, and these tiny holes cause some sort of pain or something?
Okay, so what happens is that the tooth has three main layers. We have the enamel, the dentine, and then the pulp. When the bacteria affects the enamel, usually you don't have any pain. Normally people just feel a hole in the tooth and that's it. Now, when the problem gets to the second layer, which is dentine, then you start having on and off pain. So the pain comes, it goes, so it becomes intermittent. When that happens, a lot of people don't really see us during that time. Once you take analgesics, you should be fine. But preferably, it's crucial you see us at that stage so that a filling can be done in the tooth. When the problem gets to the third layer, which is the pulp, then you have excruciating pain. Now, depending on where it happens, you could even have maybe an abscess, which is a pocket full of pus forming, and then you can have facial swelling also.
Okay. You mentioned caries. I want you to talk more about it, as I mentioned.
Exactly. So tooth decay or cavities is just like the layman's terms. When it comes to dentistry, we refer to that as caries. So it's basically the same thing. Yes, it's just the terminology that changes.
Okay. So can you tell us some of the signs or symptoms that someone will experience when their tooth is just about to decay or it's decaying or stuff like that?
Okay, so when the problem is in the enamel, usually you just have a hole in the tooth. So most people just feel a hole in the tooth and that's it, and it's usually not painful. Now, when it gets to the second layer, like I said before, that is when you start having sensitivity or on and off pain. When it gets to the third layer, that is where the pulp is. The pulp is actually the living tissue of the tooth, okay? It is what gives the tooth life. So when it becomes infected, that means the tooth is dead. So once the tooth dies, you tend to have excruciating pain, spontaneous pain also, and then you can have abscess, which is a pocket full of pus forming. So you see some people with facial swelling.
Okay. I was just about to come to, there are people who have like one tooth discolored and all the others are like okay, like the color is okay, and then they tend to have a lot of pain and then a swelling. What causes the discoloration? Okay,
so the discoloration is caused when the pulp dies. So once the pulp dies, then discoloration begins. So the color changes from the normal, maybe white or creamy or yellow.
And are people born with it?
No, not at all. Sometimes it could be caused by trauma, maybe something hitting you, falling down. So trauma can also lead to the pulp being destroyed. So it's not just about the cavity or maybe the bacteria causing the pulp to die, but it can also be caused as a result of trauma to the tooth.
Okay. So before we came on set, you talked about all smile promoting preventive dentistry, where people just come in to check on their teeth and all of that. What would you say has been the nature of Ghanaian or people towards their whole dentition and everything?
Okay, so what happens, what I've realized is that over here in this part of our world, a lot of people come to us only when they're in excruciating pain. Normally, I think people get traumatized when it comes to dentistry. They think the dentist is weird, scary, so they only come to us when they're in excruciating pain. So we want to wipe away that mentality. We want people to come to us right from the beginning and then also develop that 6-monthly routine. Just visit the dentist for cleaning, for routine checkups, so that problems can be picked up before they get worse.
All right, we're going on a break, and I know you're still enjoying the conversation. Dr. Olivia has a lot to say, but then when we come back from the break, Dr. Esel is joining us with a lot more information. Do stay tuned. You're welcome back from the break. This is still Health Afrik on AAU TV. AAU TV is still the voice of higher education in Africa. We are discussing dental cavities and decay, or dental caries and decay. I've learned a lot. For the sake of audibility, I'm going to take off the nose mask, but you should know that I'm still observing COVID protocols. I have with me here Dr. Esel to take off, continue from where Dr. Olivier left it off. Doc, you're welcome.
Thank you.
It's a pleasure to have you here. Who is at a higher risk of a tooth decay?
Okay, who is at? Anyone with a tooth, everyone. Yeah, everyone. But there are levels to it.
Okay.
If you don't really keep good oral hygiene, you're at a higher risk than someone who brushes their teeth every morning and then evening. If, for instance, as I said, you don't brush your teeth, if you are sort of exposed to a lot of sugary foods, like any drinks, like all those things put you at a higher risk as compared to someone who doesn't take sugar, someone who doesn't take toffees. Yes. So those two people, basically the sugars, and then everyone who has a tooth is
Okay. But then, is there any particular medical condition that makes you susceptible to a tooth decay or something?
Okay, there are several. Yeah, you know, in order to sort of prevent any form of dental condition, any form of caries, you need to keep a very good oral hygiene. So if you have any condition that sort of puts you in a position where you don't get to brush your teeth every morning and evening, yeah, so you can have the strokes, you can have the people who are paralyzed, all those people are sort of much more inclined to having any form of medical condition. Even can be mental illness, something that doesn't really
allow you to
do that brushing.
Okay. But what of the use of the, what do you call it? The mouthwash. You can just use a mouthwash and you're fine? Or?
No, so the mouthwash, what we usually call it, is an adjunct therapy. It's supposed to be like a supportive therapy, not like a substitute. So it sort of helps you, but it shouldn't replace the main thing, which is the brushing every morning and evening. I'm emphasizing on the every morning.
Yeah.
I know most people do it in the morning, but the evening we sort of forget about it. So mouthwashes don't replace the toothbrushing. Yeah.
Okay. But then, are people born with dental caries or dental issues? Like, is it genetic? Can you inherit it from your mom or your dad or something like that?
Okay, so your question is in twofold.
Yeah.
Dental caries as such is not a genetic condition. However, if a family has it, if it's in a family, the probability of another person also getting it, because we share spoons, sometimes in a extreme condition they share toothbrushes. So those things you can transmit it from a mother who feeding the child, and then she will take some and then give it to. She will transfer the organisms from her mouth to the child. In order for caries to occur, you need 4 factors usually. The tooth structure is already there. We need the substrate. Bacteria is already in the mouth and the saliva. The only one that we can modify is the the sugars.
Okay.
Because the microorganisms are in the mouth, saliva is in the mouth, the tooth is already in the mouth. So that's how come we sort of encourage people to keep a very good oral hygiene by brushing twice a day. So one person can, even among siblings, they will take chewing gum and then they'll bite, or toffee, they'll bite up and then give it, so you transfer it to the other person and then but it's not a genetic condition. As such. However, some genetic conditions can predispose people to having. And you know, the tooth is in layers. We have the enamel, we have the dentine, and we have the pulp. So some people are born with genetically thin enamel. So when your enamel is already thin, then it means that the slightest provocation you might get the cavity or the hole, as compared to someone who has a thicker enamel.
Wow. What makes them get thicker enamel?
Pardon?
What makes them get thicker enamel?
Well, it's genetic. So
it's
some
genetic.
families, they have a very thin layer of the enamel. Some people have, so that's
basically what's okay. But you know, I was talking about someone having a teeth or a tooth discoloration, and I'm wondering what are the treatment options for such a person.
Okay, so for one particular tooth that's discolored, that's what you want to ask. Okay, all right. So what happens is once there's trauma to the tooth and the person hasn't treated it for a long, it can be that the tooth is fractured just a little, and there's been long standing, so bacteria, microorganisms have entered the tooth. So the pulp is now infected. Even though there's no pain, or it could be occasional pain, the pulp is dead, so the tooth is not receiving any form of vitality. No blood is going there. So the tooth is basically dead. That's why it's discolored. So basically, your body is trying to tell you that that tooth is dead. What we can do is that we have either we do a procedure called the root canal treatment that will go inside the tooth itself, clean the infected or dead pulp, replace it with a material. And then the other option is either, for us, that's the treatment for that tooth. And then for the color, we can either bleach that particular tooth to make it look like the other ones, or we can put a crown on it to just mask the discoloration.
And it won't look different?
No, so we take the shade of your natural teeth and then we aim towards that one. So it wouldn't look different at all.
But then, you know, we're talking about dental cavities, and now local parlance, we call it caca. What is a treatment option for caca?
So it depends on the level of.
There are levels.
Yes, as I said, you know, the tooth is in layers. We have the enamel, which is the one that we can all see. That's the white one or the creamish one. Then we have the dentine and we have the pulp. So it depends on the level of the cavity. So it usually starts from the enamel. So if it's on the enamel, it's okay. We can put a filling on it. If it's a dentine, we can also put a filling on. But once it gets to the pulp and then you start experiencing pain, then we have to go a step further to treat the infected pulp. That's the root canal, and then we put a crown on it. Either that or we take out the tooth completely.
Okay. So what are some of the services that you offer here at All Smile and encourage people to come in? Because the place is beautiful. I love it.
Thank you so much. So at All Smile, we do everything dentistry. And we even go a step further to do a Botox, that's with the face, wrinkles, and all that. So we do the braces, we do whitening, we do cleaning, we do fillings, we do root canals, implants, anything that concerns dentistry, we do it here. We have maxillofacial surgeons, people who have impacted wisdom teeth, all those things, we do everything here. We have 2 branches also. One is at Damsuman, near the main roundabout, close to the police station. I just said the Star Assurance, and then Osu. We have 1 branch also there, which is at the in the same building as the Woodin. Okay. Exactly where we are seated right now. Yes. So we'll move on to a practical session where we can look at how teeth cleansing and teeth whitening is done, and then you tell us like the process and everything that you're doing. Viewers, that is the thing. You know, you shouldn't change the channel. It's still HEALTHAFRIK on AAU TV. Let's go on and let's have the practical session with Dr. Isel Nathaniel. All right. So I'll move your chair, okay?
Okay.
All right. And I'll bring it down a little, okay? All right. Okay. So I didn't get your name. Bridget, please move backwards a little, like I said, in very good. Okay. All right, so this is a mirror. I just want to look all around your mouth, okay? All right. So kindly open wide for me. Very wide. Okay. 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 Okay, put your teeth together for me. Okay. Okay. All right. The other thing is the diastema. Is the diastema. Yeah. As I said, well, in Africa we see it as a normal something, but in other places they see it as an anomaly, so they try and then bridge that gap. So if you're interested, you may consider braces. Yeah, you may consider braces to sort of close the gap for you. Yeah, basically that's it.
Okay.
That's it.
Okay, and then you talked about the teeth moving.
Yes.
I'd like you to explain that phenomenon. I mean, what causes the teeth to move?
Okay, so microscopically, the teeth move a little. Okay. They're supposed to be in equilibrium. Okay, so the teeth at the top doesn't come down because the ones down they sort of block it, prevent it. So once maybe the ones down there are taken off, the ones at the top might drop. Okay, but usually with the gaps, because the gap is there, your tongue sort of moves into it and it sort of pushes it small over the years. So that's what usually causes the gaps in the teeth. That's why we try and close it and hold it in that space like that. So yeah, they move. The teeth are in equilibrium. So once something is not there, it will move into that space. Basically, that's it. Yeah. Sometimes the gaps are caused by maybe you have a small tooth as compared to small teeth as compared to the sizes of the jaw. So the jaws are big, and then the teeth are small. So there will be gaps in between the teeth. So there's that discrepancy happening. Yeah, basically, there are lots of causes, but basically.
But then, can't the gap be filled with maybe filling? You talk about filling.
Yes.
So maybe you just fill it with
Yes. Yes. Sometimes we do that for very small spaces. So depending on the size of the gap, we can put filling materials there. What happens is sometimes when we do that, the teeth look very unnatural because they look so big. So it doesn't really look very natural. But we sometimes do it depending on if the patient prefers that we do it. But it doesn't really look very natural because in the end the teeth will look very big. When the patient smiles, that's the first thing that hits you. So that's basically it.
Okay.
Yeah.
And then can we move on to the teeth whitening? What goes on there when you come here for teeth whitening?
Okay, so before we do the whitening, usually we do cleaning, which is the scaling and polishing. So that one we will, as I said, sometimes the plaque becomes so hard that the toothbrush can take it off, and we call that calculus. So in order for us to move the calculus, we have a machine called the scaler. So it sort of scales the teeth. It removes all the calculus from around it. Then we polish it. So that's just with the scaling and then the polishing. The polishing makes it very smooth so that the plaque and then the bacteria can't attach to the tooth surface. Then the whitening actually changes the color of the tooth. So sometimes patients think that when we do the cleaning, the color might change, but it doesn't really change. It's the whitening that changes the color of the teeth. So that one we use some chemicals, hydrogen peroxide, depending on the percentage, and then we bleach the teeth. So that one it changes the color of the teeth. So that one is whitening. So there are two different procedures. What we do, we coat it with the hydrogen peroxide or carbamide peroxide, whichever one. Then we use we have two types. We have ones which is just the chemical cure, and then we have one which is the light cure. The light cure, sometimes people call it laser whitening. So we use this light here. It's a blue light. We will demonstrate it to you. And then we dry the chemicals that we put on the teeth, and it sort of removes all the colors from it. I just want to just chip in that naturally the color of a human tooth is not pure white. The baby teeth are pure white, but for the adult teeth, it's because of the dentine, the layer is much more thick. So it sort of gives a yellow reflection for the adult teeth as compared to the baby teeth. The natural tooth of a human being is sort of ivory colored, a bit of off-white. It's not pure white, it's like the white sheet or so when you want to do the white, you have to manage the patient's expectations. Sometimes they expect this, but in order for us to, we have to start from somewhere. Yeah, so basically that's it. Yeah, that's what we do.
Like it's a whole process. You can't do it all at once. Can you do it all at once?
You can. We have a way of doing it all at once. And then we have ones that we break it down into sessions. Sometimes it's because of the cost, and sometimes the concentration of the solution that we use. Remember I said that the hydrogen peroxide, there are concentration, you have 10%, you have 35%, you have 40%. So depending on what the clinic has at the moment, that's what the dentist will sort of use. But in all small dental clinics, usually what we do is we have the sessions one, and then we have the one at a sitting. So that one you will see at a set, you see the change from the beginning to the end. And that one, it takes about 40 minutes for us to finish. Yeah.
So why don't you do all at once if it's just
So as I said, it depends. It depends on what the clinic has, and sometimes the financial situation of the patient too.
Okay. And then there are instances where you read on the internet what do they call it? Baking soda. Or it's not caustic soda. Baking soda. As a teeth whitening agent. So we use it to brush your teeth, and then they say over time it becomes white. Is this thing true?
Well, it used to be true, but it's not very effective these days. It's not very effective. Yeah, it's not very. It has the same principle as the chemicals that we use here, but it's not very effective. So people will use it, and it doesn't really help. And then caustic soda and like the baking soda is caustic, so it sort of bends a little. So it's better you come to a professional for them to do it instead of doing it at home, because it might bend your gums, might bend your lips. So basically, I will usually recommend, and then the charcoal bit too. The charcoal is an abrasive, so it's sort of, in a way, it's like you are smoothing it out. It might not really change the color, but it might remove the calculus much more effectively than the usual toothpaste. That's basically it. Yeah. The blue light is sometimes harmful. It's actually harmful to the eye, so she'll give you different glasses to wear. Okay. Yeah. Okay. All right. Okay. Okay, so you have to smile for me. Yeah, well, mommy, retractor, no? Cheek retractor. Okay. So I want to separate your lips. Okay. All right. It's a bit uncomfortable. Okay. Okay. Sorry. So you can just take for a few minutes. So we are trying to demonstrate with the whitening. It's as if we've applied the white bleaching agent, and then we are curing it. We are sort of activating the curing agent to whiten the teeth. Okay, all right. Okay, all right. Sorry.
At this point, all I can say is don't sit and wait for your teeth to get bad. I didn't know my teeth could move. Now I know my teeth can move. So please, come to All Smiles Dental Clinic. Let them have a check. Let them do their cleaning and then whitening so that you can flash the beautiful smile. Enjoy as I whiten my teeth. See you all same time next week. Bye.